All right, everyone. Thank you so much and welcome to today's event. My name is Kimberly Blair. I'm the Director of Public Policy and Advocacy here for NAMI-NYC. This is our first hybrid event. So it's an event that we have people on the Zoom as well as in person. Most people are in Zoom. So if you want to submit questions for the end, please do so in the chat. And we will be monitoring the chat throughout the event, and then we're going to be fielding questions for the panelists. But yes,
Stop
welcome.
it. Honey, I have to watch this thing. Can you come help me, please, with Hannah? I know, but I'm doing
Please mute everyone. Please mute yourselves. Thank you. Okay, so first off, I would like to just welcome the Assembly Member Farah Safrant Forrest. Assemblymember Farah Safrant Forrest is serving her first term in the New York State Assembly representing the 57th Assembly District. It consists of the neighborhoods of Fort Greene, Clinton Hill, and Bed-Stuy, and as well as Prospect Park and Crown Heights. Before being elected to the Assembly, Farah Safrant Forrest worked for a number of years as a maternal and child health field nurse, where she would care for new mothers after they gave birth. She is the lead sponsor in the Assembly for the Treatment Not Jail bill, which we are discussing here today. And she's also a lifelong Brooklynite, and as someone from Canarsie, I just want to give a little shout out to that. So without further ado, please welcome Farah Safrant Forrest, the Assembly member, for her remarks.
Good evening, everyone, and thank you, Kimberly, for that wonderful introduction. My name is, of course, Farah Safrant Forrest. I'm the Assembly member of District 57, and I'm here to talk to you about treatment, not jail. And I also want to thank, of course, NAMI-NYC for really taking the time to highlight this bill and being so supportive of it. My staff called NAMI for advice on how to support our constituents with mental illness, and you're doing very important work in the realm of advocacy, both here in New York City and in Albany. So thank you. So I'm here to really kind of do a rough overpass of treatment, not jail. And really also, I'm here to get us ready to pass treatment, not jail this year. This is a very special bill that speaks to our community's most urgent needs, public safety, access to healthcare, and the crisis in our jails and prison. Over the past few years, there's been a lot of discussion as to the issue of public safety. But many people take a very narrow, small-minded view of what is public safety. It's usually punitive measures that are looked at, and who is really allowed to be safe. And we have talked about making it easier to lock people up, but we haven't talked about what happens to them when we lock them up. And we haven't talked about how trauma drives violence and the instability that causes in our communities. And we haven't talked about the role of how the healthcare plays in strengthening our safety in our communities. And that's why I introduced Treatment Not Jails along with Senator Jessica Ramos, to make sure that everyone who needs to be included is included into this conversation. So I mentioned earlier that Treatment Not Jail is a special bill, and it's because it looks at the larger picture. We have an overcrowded and very dangerous situation in our prisons and jails, and we are currently cramming in more and more people every day. As many as 40% of incarcerated people, by some estimates, have some kind of functional impairment. And when we talk about functional impairment, we're talking about intellectual disability, mental health issues, or substance abuse issues. And so when we lock them up, often putting them in solitary confinement, we deny them healthcare. And then what happens? The impairments get worse. And that is not public safety. It means that people with functional impairments that need more are actually getting less. And when they're denied the safety and the healthcare, and it's at the expense of the people with access to more resources, if you understand the addition there. And so what this bill does is that it intervenes at the moment where we create some of the deepest strikes of trauma and violence before someone even is convicted of a crime. And it says maybe we can change this with a different approach. Now, a little background, I did do a bill called Less is More. And so thank you. But we saw the end game, right? How we get people out of the incarceral system and keep them out. But here, this bill says, actually, let's get in the pregame. Let's look at what can we do to create a system that keeps people out, especially our most vulnerable New Yorkers. And in my professional nursing experience, this bill testifies to the fact that this not only this bill will work at keeping people out of prisons, but it also is a way that we can really begin to face the serious mental health issues in our communities. Treatment, not jail means that when you are charged with a crime, you have options. You can request an evaluation that will allow you to enter a treatment program if you have a functional impairment. All that we're doing is pre-trial. In Brooklyn, we have a mental health court that creates a model for this approach. In MD1 courts, they evaluate people and put them into a court process that supports them in getting better, getting treatment, instead of being locked up. I've been to the mental health court, and I encourage you to step in and witness it. But what I can say for the judges, for the public defenders, to the DA, is that they're all rooting for the people and supporting them in their journeys. I mean, when I went to mental health court, it was applause. I found applause. I found family members. I found a DA with a defender, with the judge, all stopping and saying, hold up, how do we make sure that this person gets better? And it's really, truly amazing. And so our bill takes these programs for drug courts, for mental health courts, and it says, let's take the best lessons from these programs and expand them across New York State. It also calls for an investment in these programs so that they can be successful. New York Treatment Court currently have a budget of between $15 million a year, which we, through the bill, want to double. That money will go to clinicians, psychologists, and other mental health programs, evidence-based mental health programs. And in 2019, the average county in the state spent as much as twice what they're spending in public, in the jails, as what they're spending in public health. So we need to flip that spending. So what's your role in all of this? I'm the legislator, right? I will literally take this bill up to Albany, but I need each and every one of you to see yourselves as part of this process. So I know that many of you know that Mayor Adams is proposing involuntary commitment for people who seem like they might have a mental illness on the streets or on the subway. And I know some of you have stood up, attended the protest, and even took part of the lawsuit that is being brought up by NAMI. Thank you, NAMI. And you might also know that New York City lost 1,000 psychiatric beds during the pandemic, and we don't have the capacity to treat people in the way that Mayor Adams is proposing. So there is a conversation happening right now about how to address these things, but treatment, not jail is not the only option on the table. Not everyone knows that this legislation exists, and many prosecutors in the state don't support it because they believe it cuts into their power. But we want to return the power back into the hands of the people that is most directly affected by mental illness and substance abuse. And so we need you to be the loudest voices in the room. So by creating a narrative that jail is the opposite of public safety and speaking in particular to the harm that it causes to people with mental health and their families and their communities. And so I found that what moves legislation through Albany is not necessarily knowing the ins and outs of the policy, reading the lines, the bill line by line, but having a huge mobilized group of people who support it, who can say, this is important and I'm not going to back down. People who could take assignments and those also who can give it. And so if that happens, if there are groups of people in Albany, in New York State, in Rochester, in Buffalo, calling their legislators, speaking to the press, holding actions, supporting their loved ones where they and when they need them the most, I believe that we can pass treatment, not jails, not in the next 5 years, but this year. And so I can't wait to hear what the panelists say. I really am so excited to see how everyone in this room and on Zoom will stand up and say, treatment, not jails now. Thank you.
All right. Thank you so much, Assembly Member, and thank you for your kind words and your support of NAMI-NYC and all of the work that you do up in Albany. So without further ado, for our newcomers who are coming in or for folks who are just joining us on the Zoom, this is actually part of a Advocacy Town Hall series. So we will be hosting these pretty frequently every few months on different topics on ways we can involve and mobilize our community members to support people with mental health conditions. But today specifically, we're focusing on Treatment Not Jails Act, which you heard from the Assembly member a little bit about what it could do for our community. But now we're going to speak to the experts and we're going to hear from them, the people who are actually working in the field day in and day out in the courts with people, supporting them through therapeutic services, through diversion programs. We're going to hear from people with direct lived experience as well on how this bill really can make a change and difference in people's lives. All right, so first I'm going to introduce to you someone who I admire and who I look up to. Her name is Elizabeth Kelly. She's going to be our moderator for today's panel discussion. So Elizabeth Kelly is a criminal defense lawyer who's based in Spokane, Washington, with a national practice specializing in representing people with mental disabilities. She is the editor of 4 books published by the ABA, that's the American Bar Association. Some of them are Representing People with Mental Disabilities, A Practical Guide for Criminal Defense Lawyers, Representing People with Autism Spectrum Disorders, A Practical Guide for Criminal Defense Lawyers, Suicide and Its Impact on the Criminal Justice System with Francesca Flood, and Representing People with Dementia, A Practical Guide for Criminal Defense Lawyers, which actually just got published this week. So she's busy. She's publishing books and then she's over here moderating panels. So we really appreciate her for being here today. She also co-chaired the ARC's National Center for Criminal Justice and Disability Advisory Board and served 3 terms on the board of the National Association of the Criminal Defense Lawyers. She is an active member in the ABA, as well as serving as their vice president in the Criminal Justice Section Council, the editorial board of Criminal Justice Magazine, and having served on the ABA's Commission on Disability Rights and as an observer at the hearings at Guantanamo. She currently serves as the editor of the ABA's annual publication, The State of Criminal Justice. Please give a round of applause for our moderator today, Elizabeth Kelly.
Thank you. And I wish we had an assemblywoman like Representative Forrest in every single jurisdiction in the country. Do I don't know what the fucking phone as well as this? Okay. Thank you. Oh, it's the technical issues. Thank you so much for coming tonight. And We are very, very honored to have 3 panelists here, as well as 1 on Zoom. And the format of tonight is basically going to be, I am going to throw out 4 very broad questions, and each of these people, based on their personal as well as their professional experiences, are going to respond. I guess we do need this. All right. In any event, first of all, we have Julia Solomon, who is a senior policy social worker at the Bronx Defender Services. We were supposed to be joined by Mark Graham, the executive director of the Redemption Project, but we do have Youngmi Lee, who is the legal director for the criminal division of Brooklyn Defender Services, and Catherine Bayuk, who is a mental health lawyer with the New York County Defender Services. And on Zoom, we have Anthony Mound, who is a proud and passionate member of the Treatment Not Jail Coalition. A couple waivers or a couple provisos before we proceed with the panel. Keep in mind that I am an attorney. Number 1, nothing people say here tonight should be construed as an official statement of the organization for which they work. And number 2, nothing anyone says tonight should be construed as legal or clinical advice. With that in mind, let's start with you, Julia. Why should we have treatment, not jail?
Thank you. Thanks everyone for being here tonight. So I'm a social worker at Bronx Defenders, which means that I work with my clients to identify their needs and goals and match them with services. And so in that sort of context, I'll just say that treatment not jail is especially important because it promotes the autonomy and self-determination of people who are seeking support for mental health or substance use challenges. And the way that that looks is that it sort of shifts the model, the way that treatment court operates from a punitive model that sets out to sort of respond to people based on the crimes that they're accused to have committed, and shifts it more towards a rehabilitative model where it actually responds to people's needs and the goals that they've identified for themselves. And the way that it does that is by shifting a lot of the decisions that happen throughout the treatment court process into the hands of the clinicians, who are the people that are working in partnership with the participants. So it actually means that the people who are participating in treatment court get to actually be a participant in their own recovery, in their own treatment process, as opposed to having those decisions made by prosecutors or members of the court that really know nothing about the person, right? And so I think for me, that is the most important part, because we know that treatment is more successful if people are invested in it, if they're making those choices for themselves, as opposed to having it sort of forced upon them. And so I really think that it will shift our treatment court model in a way that actually allows people to be more successful in achieving their own goals and the things that they've identified for themselves in terms of seeking treatment.
Thank you. Youngmi, from your perspective, why is treatment not jail so important?
I've been doing this work for 25 years. And there are far too many people in our criminal legal system who have a mental illness or a diagnosis, and we're just punishing them. We're basically locking them up and throwing away the key, where these people, and I mean people, but the trauma is even worse. People come out of the system even worse. The system of just jailing people does nothing to promote public safety, nothing to promote the racial disparities that we are working so hard to fight against. And so this bill is incredibly important to me. Just in terms of seeing and representing so many people who should not be in the system.
And one point you made that particularly resonated with me is we take already damaged people and we damage them even more by incarcerating them. Catherine.
And so just add on what she said, right now in New York State, there is actually no law legislating mental health courts. There is no law in our state that is geared towards people with functional impairments. We do have a 2009 law that was meant for drug courts. So it creates drug courts, but it's only meant for people who have substance use diagnosis and only charged with very specific limited charges that are related to the things that they say are committed when people are using substances. So we need this law in New York. And it's terrible that we don't have a law like this already, because 1 in 5 New Yorkers has a mental illness, and hundreds of thousands of New Yorkers go without any care or any treatment. And as public defenders, we see every day that people with mental illness are overrepresented, not just in the criminal legal system, but in the jails. I think someone mentioned that half of our jail population, both in the state prison system and the city jails, need mental health treatment, and most of them don't get any treatment. So this is a law we need. Our clients as public defenders, there are people who are the most marginalized. They're often people who are Black and brown. They're often people who come from the LGBTQIA plus community. There are people who are always underserved, always over-policed, always over-criminalized, and this law would protect them. This law would offer off-ramps to criminal legal involvement, to criminal convictions, to lifelong stigmas. So we definitely need this law.
All right. And Anthony, rounding out the conversation with you.
Yes. Treatment not jail is really important. Yeah, I was formerly incarcerated and I'm on parole right now. But I think that had I gotten treatment a lot sooner, I believe that my life would have been drastically different had I gotten the treatment I needed. And I see this also in my family. My father with the same problems of addiction and mental illness, and my mother and my brothers. And I believe that when we start focusing on our mental health and our community, we make our society that much better. And that's why it's important to me.
All right. Thank you for all of that. The panel is slightly rearranging itself. We will now move on to the second question, and that is, what's the impact, if any, of the mayor's initiative on treatment, not jail? Youngmi?
Oh, I think the mayor's impact is to highlight the importance of how complex the issues are, and that seeking a Band-Aid solution in terms of increasing the police force out there, trying to round up people who may appear to be mentally ill, and forcing hospitalizations and evaluations is completely the opposite of what TNJ stands for. So I just want to emphasize that TNJ is not about, people unfortunately are already involved in the criminal legal system. And so TNJ, however, does not stand for the proposition that if people are in the system, they should be forced to undergo treatment. It's purely voluntary. If people understand that they have a mental illness, a diagnosis, and they want treatment, that's the best way to have a successful outcome in a case and also in treatment. And so I think that's really important to understand that if it's voluntary, if it's also very individualized and tailored, because there are a whole range of functional impairments out there, and not every single one of them requires a forceful hospitalization.
All right, thank you. Catherine.
I think the so-called plan of the mayor pretty much galvanized our coalition into action. It shored up our alliances with other impacted groups. And most importantly, I think it's showing us that we really need to counter the fear mongering. We need to counter this narrative that's inside of its plan, the narrative that people with psychiatric diagnoses are just by existing, they're dangerous and they must be removed from public spaces. Even though the actual science does not support this, right? The actual science says people with mental illness are actually 10 times more likely to be the victim and not the perpetrator of violence. The actual data shows us that violent crime can be attributed to between 3 and 4% for people with mental illness. 3 and 4%. That's not something you would think with all the media stories, with all the politicians talking about mental illness and crime, but it's 3 to 4% of violent crime.
And Julia.
Yeah, I think that my co-panelists really, spelled it out, but I'll just add that, I think it shows us why it's so important that people who are living with mental health conditions are involved in these decisions, because when someone like the mayor makes a sweeping decision and sort of a decision that looks at people with mental health conditions as a monolith, that everyone is the same and requires the same intervention, so to speak, it dehumanizes people. It takes away their agency, their autonomy. And that's, like everyone said, that's the complete opposite of what TNJ aims to do. We aim to, enable people to access treatment on a voluntary basis, and to move away from sort of coercive models of accessing care.
All right. And I'm going to ask you one follow-up based on something that Young Mi said. She pointed to the lack of resources in New York City, and that's true nationwide. As someone in your office tasked with lining up resources, how do you deal with that shortage?
Yeah, it's challenging. It's certainly challenging. I think we're sort of always trying to fit people into a category that they don't fit exactly into, right? Because people are dynamic. People are all very different and have different needs and different goals. And unfortunately, I think we're navigating a world of services right now in New York City where it's very sort of one size fits all, the programs and services that we have access to specifically for mental health and substance use treatment. And I would really love to see programs that are more individualized, that meet people where they are. All of the residential substance use programs that we work with for our clients are abstinence-based, meaning that if you are using any drugs or alcohol, you're out. And so we would love to see some more harm reduction principles integrated into different treatment programs, just allowing people the space to be complex, dynamic human beings that they are, which I don't believe that the existing programs really do. You really have to fit into a specific mold to make it work. And that's really challenging, I think, given what we know about human beings on the whole.
No, thank you for those insights. And Anthony.
The mayor's plan kind of worries me a little bit. I know for myself, I shake uncontrollably, sweat, and go into a panic attack when I see the police. And I think that's normal for most people when they see in their rearview mirror them lights go on. What did I do wrong? What do I need to defend myself for? And this is even worse for people suffering with mental illness. We don't need armed people reproaching them, forcing them into situations that they didn't voluntarily be in. And I think just having services available, most people will take advantage of them if they're offered voluntarily. And it's easier to get people voluntarily involved rather than involuntary.
Thank you. And your point about even the mere sighting of law enforcement causes discomfort and trauma is very, very well taken. Now I want to talk about the specific program that your offices offer? And let's start with you, Catherine. Tell us a little bit about diversionary options within your office and some of the advantages of those options and some of the very real challenges.
So I think in Manhattan, is where I practice, we have available a misdemeanor mental health court and a felony mental health court. The misdemeanor mental health court is pretty new, and the judge, I'm going to give him all the flowers, Judge Wang, he modeled it actually on a lot of the TNJ principles. He basically understood the need to build in equity for clients who have been failed by the system over and over again from the start of their life until what brought them to their involvement in the criminal legal system. You just have to connect these dots. And I think misdemeanor mental health court really does a great job of kind of following the model of TNJ. Felony mental health court is structured a little bit differently. But we are seeing now a trend in felony mental health court in Manhattan to embrace kind of the best practices of mental health courts, to replace punitive reactions to somebody's relapse with more therapeutic and more understanding reactions, to provide much more positive support than any kind of negative criticism. And I guess some of the challenges would be that there's still I think it's 50 cases per year cap in Manhattan mental health court, a felony one. And I know ADA Alvin Bragg just asked the city council for more money to expand that. But when you have, let's say 2,000 people at Rikers Island who are in need of a program and only 50 spots per year for mental health court, the math doesn't add up. So that would be a big challenge.
And if I can ask you a question about both the misdemeanor as well as the felony mental health courts. Some mental health courts in this country exclude certain crimes of violence and certain, if not all, sexually oriented offenses. What about the mental health courts here in Manhattan?
So I'll say that, we're not as, I'll let you talk about Brooklyn because Brooklyn is the most expansive, but I would say Manhattan, it's been case by case. I think on paper they said they're excluding violent, but then I've had plenty of people graduate who had been charged with violent crimes and they did well, they succeeded. And frankly, the national statistic of people who graduate are 50% less likely to recidivate. So that's something there.
Okay, good. Julia, tell us about the Bronx. What are some of the options? What are the strengths and what are the challenges of those options?
Yeah. So, I mean, I will say, I think one thing that's really generally nice about treatment courts and is true in the Bronx is having, like Catherine was mentioning, a dedicated judge and team of prosecutors, specific bureau of the prosecutor's office that are sort of invested in the idea of treatment court, meaning that they do want to see, I think, the participants get the help that they need. There's some more understanding of sort of the struggle that comes with living with mental health conditions or substance use disorders. And so that's certainly refreshing compared to other courtrooms in the Bronx Supreme Court. In terms of challenges, I think I would reiterate what I said before about just sort of the programs that we have access to, that our clients have access to, are very much one size fits all. And to give another example of that, if you have a monolingual Spanish speaker who you're trying to find services for, it's very, very challenging. There are not enough Spanish speaking therapists or clinicians that are out there. And even for English speakers right now, the waiting lists for accessing these clinics and programs are extremely long. And so, I would just say, treatment not jail is incredibly important. And I think it's a first step. And beyond that, we really need more investment in these types of resources and programs. There are not enough. They're not responsive, like truly responsive to the needs of the people who are trying to access them, unless you fit into that exact sort of one size fits all model, like I was referencing. And so, yeah, I would hope that treatment not jail is a start that encourages people to invest in our communities, really, because that's what this is.
Yeah, we took a long time as a country getting to this place. It's going to take a long time to get ourselves out of it.
Yeah.
So, Young Mi, tell us about Brooklyn. What are the
Sure.
programs, strengths and weakness, or strengths and challenges?
So Brooklyn definitely has a very robust mental health court, and it's served as a nationwide model. And I think it's because the judge, the treatment staff, they have training, they have experience, they have a lot of empathy and compassion for the people who do enter into treatment, which I think goes a long way, because when you have that kind of a mindset, it's really very encouraging for the participants. It is still, however, as great as it is, and it doesn't do enough. The DA still gets to make that final decision. And we have certainly had enough cases where we've asked the DA to consent for treatment, and we always have to get consent, where we really felt that the person needed treatment and not jail or imprisonment, and that was denied for a variety of reasons. There's also an upfront, you have to plead guilty upfront with a jail or a prison alternative. So if the person is really struggling through treatment, and I've seen this happen, and they just give up, the alternative is prison. And that requirement of a guilty plea up front sometimes is very discouraging for some people who say, I don't want to plead guilty. I didn't do it. I need treatment, but I don't want to plead guilty. And so that can be a barrier in terms of access to treatment. TNJ seeks to remove all those barriers so that more people are encouraged to seek treatment, and to also not allow the DAs to have that much power. And I say this knowing that the DA's office has generally been pretty generous about allowing people into treatment, but we've had enough cases where they wouldn't consent for a variety of reasons.
Yeah, no, the prosecutor is the ultimate gatekeeper. Before you get rid of the mic, both you as well as Anthony have mentioned law enforcement. Does your mental health court do any work with law enforcement to perhaps prevent the initial bringing in of people with mental disabilities?
Well, usually, unfortunately, by the time we meet the person who's involved, they've already been involved and already had the encounter with the police department, and it's too late at that point. We will, when people call us and say, you know, the police stopped at my apartment, they're looking for me, what do I do? We find that when we arrange the surrender, sometimes we'll go with the person. It's a lot less fraught with violence and fear because
Interesting.
that encounter is very fearful. I mean, even for me, you know, if a police officer came up to me suddenly,
Sure. No,
I've seen too much of what's
the presence
happened.
of a gun and a badge.
Right.
Yeah.
So, and I just can't imagine if you have a mental illness or a diagnosis, how scary that encounter would be.
Exactly. Anthony, from your perspective, should there be certain components for different diversionary options to be successful?
I think what we're introducing is great enough, and I just think we need to intervene in somebody's life in a positive way, rather than what we're doing now.
Got it. Thank you. All right, final question. From your perspective, what, in addition to the things that Assemblywoman Forrest said, do you think members here in the audience tonight, members of the community in general, can do to promote options like treatment, not jail? Let's start with you again, Julia.
Well, there are lots of ways to get involved. Actually, if our coalition is open to new membership, we would love to have folks join.
And that's the Treatment Not Jail Coalition.
Yes, I'm sorry, the Treatment Not Jail Coalition. We are a mix of defenders, advocates, people with lived experience, NAMI-NYC, And we're always looking for folks to get involved. The legislative session starts in January, and we will be pushing, as the assembly member mentioned, we'll be pushing really hard to get this bill passed in Albany this year. We have a lobby day actually already scheduled for January 31st, and that we would love for folks to join us in Albany and help share your experiences with the legislators who would be passing the bill.
Is there any special training for that lobbying day?
There will be, I believe. Okay, I think maybe I'm going to pass the mic to
That's
someone who has
that's-
more information
I
on
was
this.
setting you up for a commercial.
Hi, everyone. I'm not part of the panel, but I'm going to insert myself. So yes, we're actually going to have a lobby day next week on December 22nd. So anybody who's actually interested can reach out to advocacy@NAMI-NYC.org or kblair@NAMI-NYC.org. That's KBLAIR. We will be doing the virtual training in order for people to know how to best relay their stories to legislators. And even if you don't have a personal person, like a personal interaction with the criminal legal system, you want to support, you want to show up and just discuss how mental health impacts you and how, this could impact your community as someone who potentially could be 1 in 5 New Yorkers with mental health illness, or the 4 out of 5 who are actually their families and friends, the supportive loved ones around. We want to make sure that you're present and your voice is heard, and we'll find ways to help you up in Albany. But what I wanted to add was we're actually providing transportation on January 31st. So we don't want any barriers for anybody who wants to go to Albany and wants to talk to either their state senator or their state assembly person. We're going to provide transportation as well as meals. And then the training, we'll do like a mini training before we go again. So just wanted to add that. Thank you.
Beautiful. Young Me, from your perspective, what can people do?
So this is a state bill. So I would encourage people to reach out to your elected state assembly member, state senator, and start reaching out to the governor because she has the final veto power. I also really think that it's important to spread the word amongst family and friends and to ensure that the fear mongering that has become the trademark for the New York Post and Newsweek, that has to stop. And we need to correct all of that false and misleading information about people who are unhoused on the subways, people who are mentally ill as being dangerous. And we just need to have important discussions amongst the people we know and to educate as many people as possible so that when we get to the lobbying, our state legislators really understand what TNJ is about.
Catherine.
Just to add to what she said, you could educate your neighbors. You could give them the facts instead of the fear mongering. You could tell them things like the things I told you earlier about the statistics of people who get involved with the criminal justice system charged with violent crimes only being 3 or 4%. You can tell them that 75% of crime victims actually support treatment and not jail. Not the bill, but people getting treatment. You could tell them that jails and prison are so expensive. It costs more than $556,000 per person per year to incarcerate somebody in New York City. That's over $1,700 a day. Whereas treatment is actually yield savings. For every $1 invested in treatment, you get $2.21 in savings yield. It's important to counter, again, as she said, their fear mongering with facts, with data, with social science. This bill is very much based on all decades of social science research. And it's important to people to understand, we're not just trying to create something and just to kind of burn it all down. This is an existing law from 2009, and we're just trying to expand it, refine it, and make it more following the science, which is what we should be doing.
And you rattled off a lot of statistics, Catherine. Where did you get those?
So I have sites, the Center for Court Innovation, the Vera Institute. There have been other studies. I'm glad if anyone wants to email me, I will send you all of the sites for every single statistic I rattled off.
Great, thank you. And Anthony, How
Yes,
how can people be supportive of treatment, not jail, as well as the entire movement of diverting people with mental illness from the criminal justice or the criminal legal system?
I'm gonna kind of be an echo in the room, the great people that speak, and you know, share with a friend on Facebook, on your Twitter, on Instagram, any of the social media you have. Let's all get each other involved and raise each other up. We can, you know, tell a friend about a story of our family members, maybe getting treatment and getting better. We have so much, we relate with each other, and if we just find out what it is, we'll make this world a better place.
Thank you. Thank you. Anthony in particular raised two great points. Number one, the tremendous, tremendous power of social media in our society. And if you are looking for Twitter sites to follow, I strongly encourage you to follow NAMI-NYC. They probably post a dozen things every day. All of them really, really informative. The second point Anthony raised is that although statistics like Catherine gave us are vitally important, it's ultimately the human face, the presence of someone we know, the life story of someone that someone else knows who has some sort of a mental disability, which helps shatter the stigma and underscore the humanity of that person. We're now ready to open up the floor to any questions from the audience, just one moment, as well as to the people on Zoom. I know there's been lots of things put up on Zoom. Again, a couple of points. Number one, please make sure that your questions are indeed questions. And number two, try and make your question as general as possible in order to be as educational and relevant to everyone. If you have a question about a particular person, a particular matter, feel free to approach any of us tonight after the panel or reach out to us at another time. So, ma'am.
So I have a couple of questions about the bill. Okay, 4 questions. How many sponsors does it have? When are the sponsors planning?
We're bringing you a mic.
Oh, okay. Yes, I have 4 questions about the bill, please. One is, how many sponsors does it have? When are the original sponsors planning to introduce it? Is there funding attached so that to the extent we need more mental health courts and or more clinics associated with them and or more mental health workers to provide the services, is that going to be funded? And the 4th question I have, is there any inclusion of supportive, affordable housing in this bill, or is that somewhere else? Because a lot of these problems can be solved by having somebody have a place to go at night. And the major flaw in what the mayor is trying to do is, it's great to dump people at emergency rooms that are already overloaded, but then you treat them for X amount of time and then where do they go? So those are my 4 questions, please.
I would say, by way of preamble, probably Assemblywoman Forrest is the best resource for those questions. So if we can't provide them tonight, maybe reach out to her afterwards.
Could you actually repeat in here?
Oh, sure. I was going to say, by way of preamble, if we can't address all of your questions tonight, reach out to Assemblywoman Forrest's office. But any of you want to make a stab at any of those questions?
Just in terms of the financial ask, we're asking for $15 million over the $15 million already allocated to the Office of Court Administration for their treatment courts.
I think when it comes to the funding issue, we deliberately chose not to include a budgetary ask in the law. This is very much of a policy-based. Budgets change. We're hoping that this law will just remain and will grow and add more participants over the years. And I say this because it's really about a reallocation of resources and funding. We spend billions of dollars on incarcerating people, whether it's pretrial or after sentence. And when you think about the investment in terms of supportive housing and treatment, it's nothing compared to how much we spend on the prisons and jails in our state, in our country for that matter. And so the budget is always changing. And so we chose not to include a budgetary requirement in the law itself.
Julia?
Unfortunately, I don't have the total number of co-sponsors off the top of my head. I can tell you it has a lot of support both in the Assembly and the Senate. Kim will provide those numbers. And then I think the funding question has kind of already been addressed. I'll just say the bill does not include supportive housing, but I fully agree with you, Danielle, that there needs to be supportive housing, investment in supportive housing. And I think just sort of what I alluded to earlier is that I feel like this bill is a beginning of something, right? It's like, if we can pass this bill, if we can get the additional funding invested in treatment courts, the other services will follow, because it's sort of a principle thing, right? It's a value-based thing. It's shifting the way that we think about supporting people, which in turn takes time to build that. So with passing the law does not come supportive housing, but I hope that that is one of the following steps. And then I think your other question was about introduction. So the bill was introduced last session. We started sort of really lobbying for it seriously last session, and it will be reintroduced this session when it starts in January, and we'll be lobbying for it again.
Anthony, is there anything you'd like to add?
Yeah, right now what we're doing is building a good, strong foundation. So, and we're gonna, I believe we're gonna build on it as we go afterwards. After we get this passed, more good will come. This is just a start.
Got it. Thank you. Thank you. And Kim.
Hi, you guys. Sorry to keep inserting myself, but as the in-house policy wonk, I feel like I wanted to make sure that your questions were addressed. So basically, as some of my colleagues have mentioned before, the bill was introduced last session. We're coming up at the end of the session has already formally ended, and we're going to start a new one. That's why most of us went out and voted in November for our new state legislators. But as of last, we had about 27 co-sponsors in the Assembly, right? And we had 16 in the Senate. A lot of them are liberal leaning members. So we do have some moderates as well. We have some issues with trying to galvanize support in some more conservative districts, as well as more rural districts where people might feel upstate. They might feel a little removed from the topic. And that's actually why it's great that we have Anthony Mound on this panel, because he's actually from Buffalo and he's from upstate. And it just shows that how somebody, this is not just New York City specific. This is not just a downstate issue. This really actually impacts people in rural communities more, because those mental health courts oftentimes are the ones we're talking about that are stripped of resources, that might have one program, like one clinical director who's coordinating everything. I'm talking about intake, liaising with the court system, showing up for court dates, and then also implementation of some of the treatment or the diversion treatment programs, right? So we really need anybody's support. If you are actually watching this outside of New York City, we would love to have you on board for our lobby day to make sure that we have that support so we can gain more co-sponsors in both the Assembly and the Senate. Senator Ramos is also another resource. So Senator Jessica Ramos, she is the state Senate lead. And you can definitely reach out to us and we can connect you, or like Google online how to reach her office to see how else like you can get more resources in the Senate or have some of your questions addressed. So it's not just Assembly Member Farah Safront Forrest. And then for your other questions in terms of the fiscal note, so our office actually, this is going to be the first time we formally announce it. Our office has been liaising with New York County Defender Services, Brooklyn Defender Services, and other orgs to try to compile research. We've been doing key stakeholder interviews with many people in the field who actually implement these court diversion programs to see how much it's costing them. What are the operation costs? What are the cost benefit analysis when we're thinking of the numbers that Catherine Bayuk mentioned before in terms of incarceration versus the yield of savings from treatment, right? So we're doing some research, and at the beginning of February, we estimate that we're going to actually publish formally a fiscal note on how much would it cost to actually implement treatment, not jail, because we are, for many of those who don't know, the New York State Legislature, from like January to like April 1st, we're really in budget season at the state. Everybody's trying to get a piece of the pie. So it's really important that we go up into Albany at January at the beginning and set our intention for the financial resources we need. It's not just enough to get treatment, not jail passed, right? We need money tied to this because bills get passed all the time without funding. And we really need to make sure that we're not just saying on paper that we're committing to people if we get this passed. We need the resources that our community need. Julia mentioned we don't have enough Spanish speaking or Creole or other languages that need to be accessible when it comes to mental health care, right? So what is it if somebody finally gets access to treatment instead of jail, and then they can't find someone in their community to offer them these services? So I think I answered some of your gaps, but if you have anything else, feel free to come up to me after the event. Thank you.
Loads of great points. And in particular, mental illness is not an urban versus rural issue, and it's not a Democratic or a Republican issue. It's multi-partisan. So other questions from the live audience or on Zoom?
Oh, I actually have one from Zoom. That's why I actually came up here. I'm sorry.
That's fine.
I'm pulling it up. So the question from Zoom is, to implement a strong mental health community model, we must address the lack of supportive housing for people with behavioral health needs. Treatment is most effective when someone has an affordable, safe home to go to. Any chance we can include housing or an acknowledgement of the need in the TNJ Act? And this also alludes to my friend over here. She actually, that was her fourth question. And I just want to make sure that the panel.
Yeah, and I think Young Me touched upon it a bit. Do you want to expand?
Could we
upon
expand
that?
some? Here, I'm going to pass the mic.
I think we deliberately chose to leave budgetary asks out of the bill because it can fluctuate so much depending on the needs. And we're just hoping to see expansion and getting more people into the system, into treatment. But at the same time, I think as we are investing more in people and not prisons, there might come a day when we won't need a treatment court, right? As we invest in providing more services, it could very well be that there won't be arrests where there's a need to prosecute people. So to ask for for a certain amount of money or to require supportive housing. And I say this because I completely agree that we need more supportive housing, but there are also some people where we don't necessarily have to mandate or find supportive housing because some people already have it. Some people already have a place to live, whether it's with their family or friends or partners, where they're still getting the wraparound services that they need. And so it's a very fluctuating thing, but I do completely agree that we need more supportive housing. There's definitely a shortage. And that is definitely delaying, I think, getting people into treatment right now.
And I just want to add to that, when someone gets a diversion, when they get sent to mental health court, they are connected with somebody who assesses them, a clinician, a team of clinicians who assesses what are their needs. And then for that person, they create a treatment plan. Not everyone needs the housing piece, but many, many, many of my clients do. And so they do get that housing piece. And I think one of the things that the person might have been alluding to who asked the question is that it's very difficult to find housing placements for people who need a certain level of care, with people with certain diagnoses. And I think that's a huge problem. I know that the American Psychiatrists Association have been trying to get people to galvanize behind the idea of safe shelters for people to not have these exclusions because of their diagnoses, so they can just get housing. And I think that's a very important piece, not necessarily inside of our bill, but that can come with it.
Yeah. And an extension of that, some people are often excluded from certain type of housing because of what they're charged with. For instance, if they're charged with arson, getting into housing is almost impossible. Same with certain sort of sex offenses. So Julia, did you want to add anything? And you don't have to. All right. All right. Next question.
Sorry, I have a lot of them now. They're rolling in, okay?
Okay. We
So-
have 8 minutes.
Okay, so one of them I can actually address right away. So we've heard a lot of state legislation. Are there any city legislative priorities that mirror the Treatment Not Jail Act on the city level? Okay, so actually I took this question because I know the answer. So really quickly, we actually have a city council resolution that was introduced by Councilmember Carlina Rivera. It currently has 16 co-sponsors in city council. It's called Resolution 156-2022. And currently, you need about 38 co-sponsors for a bill to reach the majority or veto-proof majority to get the attention of the speaker to bring it to the floor, to bring it to a vote, to really make it seem as though it's pressing that we need to pass it. Now, what a resolution does at the city council level, it's kind of like a very formal notice or letter from city council to another government entity. In this scenario, it would be to the state legislature, so to the state Senate and to the state assembly, telling them the urgent need for treatment at jail from the New York City perspective, right? So it's kind of like city council members speaking on behalf of all the residents in the boroughs and showing their support for the bill to pass. Resolutions are really important in order for state legislation to pass. So that's something that you can call your city council member and tell them that you would like them to fervently support Resolution 156-2022. All right, the next question, and then I'll hand it over again. If we can't join the advocacy day in person, can we join virtually? And if so, at what time? All right, so we actually have Casey Dal Porto from New York County Defender Services. She's a policy attorney, and in the chat, she answered yes. We will have the virtual meetings from 1 to 3, and please register online in order to join. So I just wanted to make sure that everybody saw that question and answer, because we don't want any barriers. We know that people have to work. We know that not everybody can actually afford to take off a whole day from work to travel up to Albany. So we want to make this as accessible as possible, and virtual is here to stay. We don't see it going anywhere.
And how about emails to assembly members or senators?
Definitely. We always have some action alerts that will be pre-written templates that you can edit yourself. And we will be sending those out closer to the date once it gets reintroduced, because you want the new bill number, right? You can call your legislators to show support now, but it will be more fruitful in the beginning of the next session when we have a new number for folks to call and say, we would like you to vote in support of X Senate bill or X number assembly bill. All right.
Beautiful. I think we have time for one more question. Excuse me, this woman has had her hand up.
Definitely. Come up. I'll hand you the mic. And then after that, Brian is in the queue in order
Yeah,
to.
well, I think we only have time for one more.
Okay.
Thank you so much. I actually had 2 questions that I'm just gonna try to throw out really quickly. How is Mayor Adams able to create such an unsafety measure in the community without any accountability? And why is it so easy to spend so much money to incarcerate each person, but it's so difficult to create housing, which is less expensive?
No, those are incredibly powerful questions. And I don't mean to minimize them. They're rhetorical. And I don't know that we necessarily have the answer tonight, but I think we all want to weigh in some fashion.
I'll just very quickly, I think it's sadly too much of our society and community are profit driven, right? It's too much profit over people. And I think despite a pandemic and despite seeing so much loss of human life and grieving that, I think some people have yet to wake up to the fact that we need to start taking care of our people.
Young me.
I just want to say that Mayor Adams has capitalized on a centuries-old tactic of fear mongering. This is how he got the votes. Former NYPD police officer, he is scaring people. The headlines are scaring people. This is how he gets votes. And so it's really important to spread really the truth and to stop this fear mongering. And that's what's happening. And so hopefully hopefully we can make him a one-term mayor.
Julia.
Yeah, I'll just say, I mean, I actually don't think the mayor can do this. I think that there will be challenges. I think there already are challenges to this policy. I think, he can say it and he can, talk about it in the news, but that doesn't mean that it's going to happen without consequences. I hope, at least. And then, yeah, just echoing, what my counterparts up here said, I think we are a society that was built on surveilling and incarcerating Black and brown people, and that is what we know how to do. And so we just keep doing it, even though it doesn't actually make any sense, and is oppressive and systemically harmful. And so I think it takes a lot of energy. It takes people organizing and standing up to shift things, because we just keep doing the things we've always done until we make a change. So you guys being here tonight, I think is a starting place, right?
And Anthony, you have the last word.
Yes, all of these elected officials have oversight. It's called the taxpayer and the voter. This is why it's so very important to get out there and vote. It's very important to go spread stories and get together and just educate each other and keep doing that and get these bad politicians out of office. But it's going to take teamwork, and it's going to take all of us.
All right, thank you. And
Sorry. I really do want to take the question from Brian. He's been
Okay.
waiting a really long time. So
Okay.
I just really want him to be the last question, if that's okay with everyone. We understand if people have to leave, but we really try to center peers here. And I don't know if Brian identifies as a peer, but I just want to make sure we're giving everybody the opportunity. So Brian, if you would like to unmute yourself, please feel free to ask your question.
Thank you very much. I'll try to make it as brief as I can. First off, yes, I do, in fact, identify as a peer. I live with major depressive disorder. My question it may seem a little stale because I've been was holding on to it. I was wondering, I'm hearing a lot of pushback against the police department. That there's a lot of fear when interacting with them, and I was just wondering if something can't be done to kind of maybe train the police department, maybe get some of the cops trained on how to deal with the mentally ill. I have an intimate knowledge of the 911 system and the police department, and I can tell you when we're calling 911, they may ask you if you need fire, police, or medics, but that ultimate decision is made by the caller. And if these police are going to continue to be, met with folks with severe mental illness without the training they need to properly address the situation, I think that's just a recipe for disaster before we even discuss anything else. And I just wanted to say that.
Those are great points, Brian. As you may know, nationwide, there's a program called CIT, Crisis Intervention Training, for law enforcement. Maybe some of the panelists tonight can answer if there's a training component in treatment, not jail. But one of the hopes is that CI training will become more widespread throughout the country and that it will be more robust. And often, sometimes when you hear of a tragedy with law enforcement bursting into someone's home or workplace, and there is a fatality, it's sometimes because the people on the responding team have not actually gone through the CIT training. So I see that you're anxious to talk.
Yes. First of all, thank you, Brian, for this question. I think actually it's something that our community really needs to know about, and that many people are thinking about, right? So I just wanted to address this. First, I want to say I'm speaking as a peer, as a family member, it died? Okay. As well as daughter of a former retired NYPD officer. Okay. So I'm speaking from my own lived experience, and that's what we're going to qualify with. In New York State, we've actually done an incredible job of training most of the police force in CIT, which Elizabeth alluded to. Unfortunately, in our city, New York City, we have not seen the positive outcomes that we were hoping for after implementing CIT for many years. That's not at all a slight towards the police department at all. It's actually highlighting what's a national conversation, a national movement that we are all seeing with evidence-based practices, that the police, then they sign up for this job, they're signing up for public safety emergencies and not necessarily public health responders. Like, they're not signing up to become public health responders. So what we are moving towards, and NAMI-NYC is a coalition member, as well as many of the folks up here are coalition members as well, and supporters of peer-based non-police response as an alternative to mental health crises calls that traditionally have gone to 911 and the NYPD, right? So through that, and just to wrap it up, because I don't want to take everybody on here, but through that, there are already some things in place that I'd like to share with all of you. So we're part of Correct Crisis Intervention Today, New York City. It is a coalition that focuses on peer-based and evidence-based alternatives to alternatives to police response to mental health crises. We want to focus people who have the clinical training, who have the lived experience to respond to these crises calls. The proposal that is going around is for one peer worker with a independent medic who would be separate from EMS, which operates under FDNY, that is trained heavily with the NYPD as well, right? We want to separate it out so that the police can focus on the actual public safety emergencies we have around the city and the state, and so that we can actually send the experts to these mental health calls. Now, something I want everybody to know about is the importance of 988. Remember that number we have over here, some different stickers for your phone for you to remember it. It is the new 3-digit crisis number nationwide for mental health emergencies so that we can actually separate these calls out from going to 911, right? So when you call specifically in this city, you get paired with the call center that's operated by NYC Well. And for anybody who has an out of New York City area code, you can call NYC Well directly. It's like 1-888 NYC Well. And you can be either through 988 or through 1-888 NYC Well paired with either a clinical social worker or a peer hotline responder who's trained in de-escalation and how to really gauge and triage whether somebody needs maybe a mobile crisis team to go out, right? Or maybe what other alternatives we can do to de-escalate someone in crisis. So these are the resources I would like to leave you all with, because obviously TNJ is just one part of the pie. We have so many things that we need to focus on in order to really truly support wraparound services. But I'm going to just make sure that there's something that the panelists would like to add.
Thank you for all that. And I want to take this opportunity in closing, not only to thank all of you for being here in person tonight and thank all of you on the Zoom, but also to thank everyone from NAMI-NYC, in particular, Kimberly Blair, who put her heart and soul into this program.
Thank you. All right, and then it concludes the end of our program. We really want to thank our moderator, Elizabeth Kelly, and all of our panelists for being here today. Again, we have our Treatment Not Jail Advocacy Day on January 31st. Please do reach out, advocacy@naminyc.org. We can connect you to the coalition. We could connect you to our Advocacy Ambassador program. We will be continuing to do these town hall series throughout the year. So thank you for your support, and we hope to see you January 31st.